Well, I was on the ANA board when the notion of the academy was discussed. Its birth was controversial because it disrupted the fiefdoms at that time. It was not an idea that was embraced. And if it hadn't been for Reba de Tournier, it wouldn't have happened. But Reba's experience, her knowledge, and her political expertise was wonderful as she championed the need. Reba was absolutely convinced that it was nursing's obligation to society. In fact, its moral obligation to contribute in a scholarly way to the profession, to healthcare in general, and the profession in particular.
Several presidents before me had dealt with the whole idea of organizational structure. We were under the auspices of the American Nurses Association when we began, and the presidents before and during my presidency really wanted to move us toward a more autonomous organization that could use a high level of expertise in nursing to address policy issues. We worked out through many hours of talking, negotiating, thinking, a memorandum of understanding between the American Nurses Association and the Academy that would move us progressively toward autonomy.
When I became president, we were still in the midst of consolidating our operations in Washington, D.C., and more autonomous from the American Nurses Association. And that's what I thought that would be the whole thing we'd be doing. Well, as it turns out, it wasn't. We made the decision that we were really going to become a policy institution, and that by being located in Washington, D.C., we were not going to continue to have our annual meetings in resorts, but rather to continue to have them in Washington, D.C., so that we could get to the business of impacting policy through nursing.
We have a responsibility to grow the Academy, to both financially and with members, and a responsibility to make sure that the commitment to scientific work and policy work is supported and advanced, so that the Academy, in fact, can be and will be and always will be a big voice for the profession and the patients that we have a licensed responsibility to protect.
The board decided that we were going from a task force on diversity and inclusion to making it a regular committee. And in fact, we put forth at a regular Academy meeting that we wanted to be a model organization for diversity, inclusion, and belonging. And while we've got work to do, to continue to do, to live up to that aim, I think it was a really important commitment back at around, I want to say 2015.
Part of the work of our task force was to assure the inclusion of all voices and that all voices were welcome.
We are so proud of the fact that we have the Academy encompasses a wider representation of nurse leaders today, nurse leaders who reflect a global society.
The work of advancing equity, diversity, inclusion, justice, and belonging is a journey and not a destination. And the Academy is committed to improving the health and well-being of those who are in our care, the fellows in the Academy, and the structural barriers that are confronting not only us within the Academy, but also nursing and the society at large.
Healthcare systems were rapidly changing and transforming in the United States of America, and we felt like we needed to develop leaders who can anticipate the new games and the new rules and anticipate and define the evolution of our healthcare systems. Those are the reasons we need nurses to be able to be the leaders that we are and to have our seat rightfully at the tables, all tables, research, policy, innovation, practice. I could go on, internationally as well, so that we can take care of the people that we need to take care of and all the populations in the world.
Well, in the early 80s, we were having a terrific shortage of nurses. It was just awful. And part of the shortage was being caused by the fact that nurses would take a job in a hospital and leave. And when I was asked to chair this group, we were to look at the shortage of nurses. So we sat down and talked about the fact that everybody in the entire nation, and actually in other countries as well, was having trouble with nurse turnover. We need to study the places where people stay in their jobs. They love the place and they don't leave. And there are hospitals like that in this country. We just have to find them, figure out who they are, and then try to do some work with them to figure out what they're doing right. One of the members of our committee said, you know, we have schools in our country, in our part of the world, where, her state, I think, where we have magnet schools. And she said, we ought to call these magnet hospitals because they attract and retain their staff. Well, I have to tell you something, that's probably the best contribution anybody made, because everybody wanted to be called a magnet hospital.
The continuity of support for the idea of magnet across really all the presidencies since the really the late 70s. And the impact even to today that continues to grow with almost 10% of US hospitals being magnet recognized. And it seems to me that every hospital that's not formally magnet recognized wants to be or is on the magnet journey.
I was president during the COVID pandemic. From the start of 2019 to 2021 was my term as president. And so I think the most impactful thing was how were we going to not only respond as an organization to continue the work that we were doing on a daily basis, but also our policy work and our presence, speaking for nursing, speaking for society, and helping to educate the world about what nurses are doing and also what people needed to be doing during the COVID pandemic. We saw the murder of George Floyd, and our response as an organization to fully embrace the horror of that particular situation and speak out and use the words Black Lives Matter for the first time said a lot that nurses were calling out the horror, the tragedy, the injustice, while we are the trusted profession in society, made a great deal of difference. And it also made a great deal of difference to our fellows of color and to nurses of color around the world.
It means so much for me to be the first man to lead the Academy. I had the opportunity to work with Dr. Ernest Grant, who was the first man to lead the American Nurses Association. And Dr. Grant and I were presidents at the same time, first men to do so for the ANA and for the Academy. I think it represents that we're in an era where what matters most is your contribution in nursing, your leadership in nursing, and how your impact is experienced